Welcome friends, my YouTube channel, that is Sumit Rawat Mbbs. So friends, that we have started the examination of cranial nerve, the CNS examination part. Now we talk about the 3, 4 and 6th cranial nerve examination. That is the supply to the extraocular muscle of the eyeball. That is oculomotor, trochlear and the abducens nerve. So friends, just we start the examine. So first we will talk about the some theory part of that 3, 4th and 6th cranial nerve. That is all the extraocular muscle which is supplied by the third cranial nerve except the LR6 and SO4, that is lateral rectus due to the fourth cranial nerve and the sixth cranial nerve, and the SO4 which is superior oblique which is of fourth cranial nerve. Except these all are supplied by the third cranial nerve. So just we examine the extraocular muscle functions by just indication the patient that the first we will talk about the procedure, that is a make your hand toward the palm. Just put your left hand toward the patient's overhead and indicate that patient that see for सामने देखिए एकदम straight. So said told them to stay forward to a distant way. ठीक है, just examine the extraocular muscle by just put your index finger towards while indicating the left side, that will be took the index finger towards left side, that the indication of lateral rectus of left eye and the medial rectus of the right eye, just like the same as towards other side, that is the medial rectus of left eye and the lateral rectus of the right eye. Then we put the index finger just over the head. Us look at this. When the patient look at this, the superior oblique and the inferior oblique of that right eye or left eye, just the indication of extraocular muscle. While the same towards the downwards of the index finger, we examine the both the muscles of inferior rectus or inferior oblique. So this is the indication of all the movements while putting the index finger of or toward the patient. Okay, that is the one way. Now the other way is to the light reflex. That is a light reflex is one of the two reflex which consists of 3, 4 and 6th cranial nerve, that is light reflex and the accommodation reflex. First we talk about the light reflex. Light reflex just we talk about with two types, that is direct or indirect. First we talk about the direct reflex, that we just take with the torch while examining the, we take the torch and just ask the patient just toward the left side while we putting the this toward left side, but don't be put like this slowly, and we just examine toward the right side just frequently to see the pupil of that eye toward the right or left which is dilated or constricted. Okay, so look at, when you put like this just immediately एकदम फ्रिक्वेंटली आपको इसमें इंजेक्ट करनी है लाइट, ताकि आपको डायलेशन एंड कॉन्स्ट्रिक्शन ऑफ पीपल देखने को मिल जाए. तो जैसे आप लाइट इंजेक्ट करेंगे तो दैट्स अ कॉन्स्ट्रिक्शन ऑफ पीपल आपको देखने को मिलेगा. जिस तरह से भी आपको लाइट को इंजेक्ट करेंगे आइदर राइट साइड और लेफ्ट साइड. ठीक है, तो दैट्स इज द डायरेक्ट लाइट रिफ्लेक्स, दैट इज ऑफ क्रेनियल नर्व, अपनी जो थर्ड क्रेनियल नर्व है उसका. Next one, that is of indirect light reflex. We just ask the patient to put his or left hand toward the over the nose towards, and when we take the light from other side, left side, just examine the right side pupil. When we take this, just we show the other one. ठीक है, if this is dilated or constricted, the we examine the indirect light reflex. ठीक, that's a one way. Now the second reflex, that is accommodation reflex, which is just tell the patient just look at my 10 to 15 centimeter away the index finger of our toward the patient, put him over the eyes and ask the patient to look at this point of the index finger. Just us look that point. The patient continuous looking at this and look at their pupil that accommodate or not. Don't move either or either. Just put over the nose, just mid of the nose. ठीक है. So just put the accommodation reflex. So that is the one way of doing this. Now that is the, we have talked about the three reflex, that is direct light reflex or the accommodation reflex. This is the functioning of the extraocular muscles of the eyeball, which is of, just we talk about there's a lateral rectus, medial rectus or inferior superior oblique, all the 6 muscles. ठीक है दोस्तों, तो बाकी अपन ने 6 की 6 मसल्स के एग्जामिन करा. तो इट इज 3 वे while we just putting the movement of index finger. Next one is by putting the torch of the light of the torch, And the next one is the just accommodation by indexing point of the index finger. This is the way we examine all the cranial nerve. Now we talk about all the cranial nerve, as we know, talk about the theory of that all the cranial nerve. So we just put and indicate the patient that the patient should be straightforward. So just this is all about the third, 3, 4 and 6th cranial nerve examination. Next we will talk about the 5th cranial nerve, that's later on we put. If you like the video or if you just know about the learning lesson or gain some knowledge about all the 3, 4, 6th cranial nerve in your practical examination, just to share with your friends or like or subscribe my channel. Thank you so much guys.